I will go ahead and hand it over to Sierra. Oh, wait, sorry. If you have
Yep,
any
yep, yep.
questions, feel free to put them in the chat, or you can raise your hand and we'll get those answered for you. And with that, I'll hand it over to Sierra. Thank you.
Why, thank you. Thanks, Sam. Good morning. Thank you so much for being here. I just want to start by saying thank you to the Arkansas Commission on Child Abuse, Sexual Violence, and Intimate Partner Violence for inviting me. It's really an honor to be here with all of you talking about something that I absolutely nerd out on. I love it so much, and I just really appreciate you sharing space with me. In the title, it's a little bit of a play on words. Today, we're going to look at the social ecological model with the idea of revising it and re envisioning what it can do for us as practitioners, not just a diagram on a slide or something that is sort of like a philosophy that we are to follow as we do the public health approach to primary prevention. What I want us to do is use it as a practical tool to challenge power, to connect strategies across the levels, and to sustain ultimately our prevention work over the long term. And because the environments and communities around a person should ideally wrap them in safety and support, like a hug is meant to do. So, as we talk today, I would like you to keep that image in mind that each layer of the social ecology is a kind of supportive hug that protects people, as in all people, from violence perpetration. And so, who am I? I am Cierra Olivia Thomas Williams. I am a Miwok woman with multiple unseen disabilities. I don't call them invisible because my experience is absolutely shaped every day by these disabilities, but I've become very good at masking them from you. I started as a volunteer back in 1998 and over the years have professionalized. I spent 18 of those years in crisis services while also doing primary prevention. And so, all total, I've been practicing primary prevention of intimate partner and sexual violence for 25 years. And for the last 15 years, I have worked with other disabled people to incorporate the values and principles of disability justice to create and drive the strategies that impact people who experience the greatest burden of violence in this country. And to do that, so I spent 10 years recently at Indiana Coalition Against Domestic Violence. I did lose that job from the state withholding funding for the rape prevention and education grant. So after 10 years. But while I was there, I founded a program called Indiana Disability Justice. And over the last 8 years, we created the Disability Justice and Violence Prevention Resource Hub. It is linked in your PDF, and I encourage you to go there. It collects the stories and experiences of people with disabilities who are survivors, who give us their recommendations for ways that we can be inclusive in our violence prevention practices and ultimately address systems of power. And because I'm no longer employed and also for lots of other reasons, I founded my own thing called Nothing Without Us Collective. And, the Nothing Without Us Collective is a cross disability and survivor led group. And our whole goal is to advance access and accessibility and really bring in the leadership of disabled people to the anti violence movement and the public health field, really. So everything that we do is grounded in disability justice. We center the people who are most impacted. We critique power and build cross movement partnerships that focus on long term impact and change, not quick fixes. And so, before we get rolling, I have two questions that I want to ask you. And I want to acknowledge because we have kind of a small group. Um, this question is a vulnerable question. And so I would love it if you could take a moment and um, use a QR code to the best of your ability. You know, some people aren't, not tech savvy and whatnot. That's fine. This is a word form that is embedded and it is supposed to tell us the answers in real time. So I'll just give you a moment to open that and you will find two questions. This question, I want to know if there are others who identify as people with disabilities in the room. And the second question is about how long you have been in the field. So I'm just going to give it a moment. Something that I've found is with this embedded form, it's kind of hard for me to navigate. So we're going to see how it goes. Let's see if anybody answered second question. Okay, no responses received yet. Okay, so for the sake of time, I will move on. But one of the reasons why I'm asking you how long you've been in the field is because we experience like really high turnover rates, as I'm sure you know, and this has a negative impact on the field. We lack field elders. Like what I mean, like elders in the Miwok way are the community leaders and the people with the wisdom. So and that's a tribe from now California, by the way. And when this happens, we lack institutional memory. And so there's long-term impacts also cannot happen if we don't stay and practice those long-term approaches. So our plan today is to grow together, to rethink how we use and understand the social ecological model. I want to question the usual narrative of the SEM and what purpose it really serves us in our violence prevention work. I want us to revise the narrative to explore power and context and sustainability. I want us to connect the dots between each of those individual levels and our violence prevention approaches so that we can see whether or not they build on each other or if they remain in silos, which is what I was doing when I was practicing at the local level. I had like projects that didn't really talk to each other, like in an organization with their policies around relationships and then teaching at the school, and the two didn't reinforce each other. They weren't related. And finally, I hope that we can talk about and identify where impacts happen. So I want us to use the social ecological model as an evaluation tool and literally map what we are doing onto that resource so that we can see where our strategies are making changes. Because sometimes we will put a program at one level and say it's community level prevention, but the actual change we see might be happening at a different level. And we need to be able to pinpoint that so we know if we are effective. So this is what we know from the model. This is actually the website, and it, like in the past, it had a little booklet. This was the first hour of my first day in a local program in 2005 in Bloomington, Indiana, where I am now. So I read this and I understood. I thought I understood. I didn't. I was like, it seems obvious. Individuals exist within context. Absolutely. And our behaviors and experiences are shaped by those. We are encouraged to reinforce our strategies by connecting them across the levels. And the story that's told about prevention is that primary prevention stops violence before it occurs, which means there's a timeline, an individual timeline for each person that begins with your birth. So the individual is centered in the CDC's public health narrative. It's always looking at the problem and defining the problem from the individual level to prevent individual harm. And as I it underlined those for you, but also another thing is that victimization is always first and foremost, and most of our strategies really center on those and skill building. But victim victimization isn't perpetration is not effectively addressed. And I really want the CDC and public health practitioners and scientists and people who are doing the work to understand that preventing victimization is the impact of our success. Victimization is an outcome of the problem of sexual violence and intimate partner violence perpetration. It's power over behaviors across all levels of the social ecological model. So victimization is not the problem. Causing harm is the problem. Victimization is an outcome, and we need to treat it that way. But that is not the narrative that we get, and that is not the support that we get. So, one of my points as a practitioner is that preventionists are not supported to use best practices. The public health approach to primary prevention of violence says the focus of public health is on the health and safety and well-being of entire populations, and that the public health approach strives to provide the maximum benefit for the largest number of people. And these practices read to me like they are not about individuals. And we are not supported by the research or the evaluation or the funding to do this public health way. And we ignore the narrative in our practices, and we ultimately fail to support the individuals we want to change. What would change for us preventionists if narrative and research and evaluation and funding addressed power over behaviors and policies and practices? So the best public health practices of primary prevention of violence were never meant to be ahistorical or individually focused. And we are actually not encouraged to read about the theory that preceded the social ecological model. And it's really important for us to understand the significance of context in this theory, which is what the social ecological model is all about. So, social ecology theory reminds us that people's lives are shaped by social, historical, cultural, and institutional contexts long before any individual person makes any choices. So this timeline is that violence starts, or, like violence prevention can start at your birth, and that your experience of violence sort of starts there. It's false for so many communities. And I wonder, speaking from the perspective of a disabled Indigenous woman, I wonder, I know there was never a before the violence for my community. And this comic, I think, is a really great example of how a context can shape our experience as people. And so this was created in 2002, and was inspired by a real child's experience at school. So the child says, "Could you please shovel the ramp?" And the dude who's shoveling it says, "All these other kids are waiting to use the stairs. So when I get through shoveling them off, I'll clear the ramp for you." And the child responds, "But if you shovel the ramp, we can all get in." And like when I read this, I hear the social norms that center the experiences and needs of non-disabled people over people with disabilities. So the ADA was brand new, a brand new policy when this comic was created. So it wasn't supported institutionally. So there was a lack of policy and organizational practices that were in place to shape this worker's behavior. So people are experiencing power over at multiple levels long before this child came to school using their wheelchair. So this is a very simple, very cheap environmental solution that demonstrates the power of environmental changes and their impact on the greater public, not just an individual who's experiencing barriers.
Hey,
So this
Sierra.
is what I, yeah,
Sorry to interrupt. Do you
okay.
know if there's a way to make the slides a little bit bigger on the Zoom view
What
by
are
any
you
chance?
seeing right now?
So we can see them. It's just a hair on the small side.
Uh, hmm. I wonder how to do that. Okay, I don't know how that happened. Um,
I'm
hmm.
sorry. I tried to change my view, but it didn't help. So
It did not help when you changed your view. Is
yeah,
it my face really big next to
yeah.
Yeah.
okay.
It's okay. If it's not possible, it's okay.
Okay, I want to try to figure this out.
I'm sorry.
No, I'm glad you said something. It's strange that my view would supersede yours. Um, what happens if I do that? Anything? Um, let me let me put this back. Let me see. Would if I turn my screen my face off, do you think it will change anything? Did that change anything?
It didn't. So if I had to guess, it might be in the Zoom, like either the screen share options or the view options.
Okay. One participant view. Uh, if I hide self view, okay, I'm gonna hide self view. Let's see what happens. Did I go away?
No.
What is happening? Uh, I I am not um I don't know. I don't know what's happening. Um, I don't see any. I've never had this happen before, so
Will
I
you
don't.
be able to share after your presentation?
Will I what?
Will you be able to share your slides after your
Uh-huh.
presentation?
Sam emailed them.
Oh, I'm sorry. Okay.
No, that's okay.
Yeah, they're
And I would go ahead.
sorry. They're attached to the
Oh, that's
calendar
okay.
invite, but I'll also send it out afterward.
Well, go ahead. I'm sorry to interrupt.
Oh no.
No, you're fine.
Um, just found a new thing. Hold on. Layout and share options.
Oh, maybe.
Okay. Oh, it's that new thing. How about now?
So the it's still half and half, but the right side was just a blank screen.
Oh my gosh. Okay. So what you're saying is you're now not seeing my presentation?
We can see it now, but it is still
Oh,
half and
you can
half.
see it well or no?
No, it's still the half and half.
Okay. Dang it. Content. So it says presenter layout. So that's not yours. That's mine.
Yeah, I think so.
I don't know what to do about this, honestly.
Okay.
Shoot, I should have got on earlier or something. I don't know. I don't know why my face is there. I've never seen this before. Usually, like your little face will float.
Yeah.
Um, layout and share options. Okay, let's see what happens when I do this. Anything? Oh,
Mm-mm.
wait a minute.
Right?
Hold on. Is this doing anything for you? I just made my face tiny. I'm assuming that this is just me.
Yeah, I think that one is just you.
Y'all, I don't know what to do. I suspect you need to do it on your end. So if you see the tab on the top, it should say Sierra screen or something like that. There's 3 dots. I was able to change my experience in the window. Do you have that? Do you have the tab that's on the like at the very top of your Zoom screen? On mine, I can see like a tab that says my screen. Do you have that?
Yeah.
Click on the 3 dots and see if you can manipulate it in some way. I don't, and you're saying if you go to view, it's not doing anything. I don't know what's happening here, guys. People, sorry. And now I don't know where my, well, I think in order to share, I think I need to get rolling and I don't know what to do about this. I've never experienced it before and I'm so sorry.
Yeah,
Um,
I'll in the meantime I'll look around and see if I can't
okay,
find
I
anything
appreciate
for you.
that.
Sorry
Appreciate
about
that.
that.
Okay. We you know, we roll with the I'm just like endless tech problems lately. So anyways, okay, so this is my revising, re-envisioning what the SEM can do for us. So we know that environments shape relationships and people's individual experiences, thoughts, feelings. The SEM is also an evaluation tool that can demonstrate where your strategies and your approaches align or misalign. And it's a way for us to literally map out our impacts to see the strength of our work and find the gaps that we could like fill because we may find that we are not doing what we thought we did. But before we do that, it's really important to center and examine power because we know violence itself is an abuse of power, and that when we address the root causes that are tied to societal level power imbalances, we are more effective for the health of the public. So if our strategies don't examine how power is operating, we might actually miss what is really driving the problem that we have defined. And in your slides that Sam sent over, you can click on those links to go to a really great prevention strategy decision-making tool that will help you do just that, looking at how power is operating in your strategies. And so what I would ask you to do moving forward is asking yourself as you're engaging in your work, where's the power? How am I exerting power? Who's included? Who's not included? Who benefits? And this is going to point us toward prevention work that is transformative. And so just to get in a little bit more depth into these ideas, that human behavior is always shaped directly by the larger contexts. Community ecosystems are there long before we're born and long before we make conscious choices to harm or not harm. So addressing these contexts are critical to end these problems of power over. And so when we work to create these conditions that to choose non-violence when they are faced with an opportunity to use power over someone else. So when our strategies do this, we put the burden where it belongs. Because too often we place the entire burden of preventing violence on individual victims to protect themselves or individual would-be perpetrators to make better choices. But let's consider how organizations and institutions shape not only the quality, but the quantity of resources that are available to every group, every community, and every individual. So governments, policies, schools, workplaces, cities, faith institutions, these set norms that allocate the resources that either increase safety and respect or allow and even encourage violence. And this puts the onus on us as practitioners and as a society to set people up for these healthy, nonviolent choices that we want. And if we make environments that reduce toxic stress and address these imbalances of resources and opportunities, we can really create impact. So rather than focusing on people's individual morality and knowledge, we can move towards accountability for communities and institutions to create supportive conditions. And so not only can we do that, but we begin to see who we need to partner with at each level to get us towards our ultimate goal. And when we engage partners at the higher levels, we find that change at those levels supports relationships and individual well-being. And that's that cocooning people in that good safety, connectedness, public health hug. So the social ecology can also help us map our strategies. And I mean that literally. And Sam sent you a workbook that I created to help you do just this. And so what the SEM can do is show us that our strategies are aligning with the approaches or the things we actually do to make nonviolence the easy choice. And it sounds obvious, but in practice, it can get lost. So if our desired impact is to end violence, then we need to ask each strategy, is this creating the conditions for nonviolence? So let's just take a very relatable and I feel like pretty rooted in our historic practices example. So we're doing teen dating violence prevention curricula in high school. And we know that it's effective to increase people's knowledge and skill building. Students learn about healthy relationships. However, that same school has a dress code policy that shames girls for what they wear and sends the message that girls are responsible for controlling boys' sexual thoughts. So the environment and the participation of the adults implicitly and explicitly reinforces those normative power imbalances. It promotes a narrative that can feed into rape culture, and victim blame. So our program says respect others, but the policy says girls are a problem, and that's misalignment. And alignment makes the work easier, it makes it more effective, and ultimately far more efficient for the tiny resources that we have, like our organizational time and money and our human energy. Because we know that when environments support choices, change is easier, and so is our work. And we can last longer in the field then without burning out. So there is a self-care aspect here to that community care that we want to create. If you're struggling to get individuals to change in an environment that is counteracting your efforts, you will exhaust yourself. But if you align change at multiple levels, you aren't pushing the boulder up such a big hill because the environment will be helping you. So when you literally map these out, you can notice how related your approaches are, and you can really notice the desired impact because it will clearly be revealed. So the third piece, I'm sorry I'm talking faster than I normally would. And so you'll have to tell me if it's impacting your accessibility or not. This third piece is really about using the SEM as an evaluation and reflection tool. And when you map your strategies, you can see where change is happening. So what I mean by this is I did this in the past. I listed my activities at each level. So the individual level, we teach classes. At the relationship level, we have support groups or peer skill building and conflict resolution. At the community level, we hold events like Take Back the Night or things like that. And that tells us where we are doing things, but it doesn't necessarily tell us where we're making the difference. So one example is holding like a tabling event at a community fair. And you might label that as a community level activity, but ask yourself, what is actually changing because of this? Are you impacting community norms? because often the impact of these kinds of things is on individuals who attend. So they learn something, or, you know, if they take it back to their relationships and have conversations with their families. But sometimes we call that a community level strategy when the impact is at the individual level. So that's a misalignment problem. So I encourage us to use the SEM to map outcomes and impacts, not activities. I mean, it helps to know what activities you're doing, but for each strategy, what level of the SEM is experiencing change as a result? And when we use a backward design approach, like I suggested, like you start at the society level and work your way down, you can identify the impacts that you want to happen at each of those levels and figure out what needs to happen in order for you to achieve that. And this assures you that your strategies are aligned with the impact that you want. So working backwards from the root causes to the ultimate outcomes. And by designing it this way, you're more efficient. You cut out activities that aren't contributing and you strengthen the activities that are. And one of the outcomes of this is sustainability in our field. And when I say sustainability, I mean the outcomes and our experiences as practitioners doing the work, because not all strategies are equally sustainable over time. Individual and relationship focused strategies require active investment and repetition. And this really takes a ton of time out of local preventionists. I think when I was in the local program, I served 16 schools. I reached 2,000 children, and I think I did over 356 of the same curriculum, 356 times. And so that required a ton of my energy and all of the shelter's resources to just have me do that. And so I wasn't addressing environmental conditions, and I wasn't supported to do that. And so I want to take you through a project that I did in my early years at Indiana Coalition. I called it Sidewalks to Sexual Violence. It's a project replication guide. That little bit.ly link will take you there to the hub that I told you about, and you can download this and the tools we created together. And this was a project that centered people with cognitive and developmental disabilities. So I'm going to use this to demonstrate the application of that narrative shift that I talked about. Before I talk about how I implemented the public health approach, I want to highlight a quote from this because it really captures this philosophy. Creating protective environments wasn't just about infrastructure. It was about shifting power by ensuring people with disabilities are part of the decision-making and design process for the city they lived in. And that was about environmental change and power redistribution. So I called this the Inclusion Collaborative, and it was a cross-sector collective led by people with cognitive and developmental disabilities. Our partners included university, family members, disability serving organizations, city planners, government officials, public health folks, and very critically, the Rape Crisis Center and the areas on aging. So we had multi-generational, cross-sector, multidisciplinary group of learners working together on this. And so how the Inclusion Collaborative implemented the public health approach was we started with the problem. People with disabilities experience the highest rates of sexual violence in the country, and yet are left out of most services and most prevention. In fact, there is only one evidence-based primary prevention program focused on women with disabilities, and it has been rated as moderate to low effectiveness by the CDC. So my strategy was the how. How would we address that problem? Always includes targeting those risk and protective factors. So my strategy was I wanted to create protective environments with, not for, people with cognitive and developmental disabilities by reducing the risk factor of isolation and increasing the protective factors of social support and inclusion. And the bonus of this is that those protective factors reduce 6 forms of violence across the social ecology: child maltreatment, youth violence, sexual violence, intimate partner violence, elder abuse, and suicide. It's efficient. So the ways that we approached the implementation of the strategy included a lot more than this example that I'm going through, but some of the things that we did to get at protective environments is we formed a collective that I told you about of diverse partners. I forgot to tell you that the city transportation departments were also part of this effort because if you don't have transportation or mobility, you're isolated. And so they were critical to this. And so the important part about this is that people with disabilities led every decision here. And so what that did is it flipped that typical power dynamic that exists. People with disabilities were not passive program recipients of knowledge and skill building. They were co-creators of this multi-level strategy. And we worked on accessible community level evaluation tools, and we had to create them ourselves because there is no process right now that assesses social inclusion and support at the community level. We do have historically used evidence-based individual level assessments of these things, but we needed something that would do this at the community level for this. And so we created these. We created the tools together as a work group, and we did community mapping of 9 neighborhoods, businesses, and public spaces. And so everybody went out on excursions led by people with disabilities to identify barriers in Bloomington to inclusion and social support. And so the outcomes and impacts of this were so that some of the outcomes included accessible evaluation tools, and we implemented them to look at social inclusion over time. We established a network of partners that now had great cultural competency and responsiveness regarding people with disabilities. The transportation department actually taught the people who part of the collaborative who didn't know how to read maps. That isn't like I used to have an atlas in my car, and now I have GPS, and I don't need to, necessarily know how to read a map. And what ended up happening is they wrote a book together for the community of Bloomington called A Guide to Ride, which also included safety against sexual violence, because sexual violence can happen on buses and things like that. But anyways, we ended up going out into the community. In the book, you can read about it, but we identified more than 100 barriers to inclusion. We identified about 30 ways that Bloomington was doing it wonderfully. One of the excursions mapped the library and found that for blind people, literally a death trap. Like the way that the stairs were, I can't go into great detail, I forgot, but it's like they mapped the library, and as a result of that, the library interior was completely redesigned. They renovated the spaces to open up. They added accessible software to public computers, and they created clearer sight lines for the staff and more community engagement. And one thing that I never imagined would happen is it got rid of almost all of the overdoses that would happen in the library by doing this, by just reconfiguring the library. People were more connected. There were less opportunities to isolate people in the library, to have the privacy to be able to use substances. Now, I do want to say that this displaces the problem. The library became safer, around like less overdoses, but that does not mean that it fixed this in the community. I just want to be clear about that. This was to this one place. And so, whoops, I think I just advanced the slide. Okay, so that was a huge huge impact. One of the things that we also did was we increased social support and inclusion by increasing the mobility of people who didn't have any in the first place. And so they could connect to work, doctors, play, friends, just by being able to use maps and ride the bus. And so that was an incredible sense of freedom for people. And one of the greatest outcomes that we still benefit from today is sidewalk connectivity. And that is a literal connecting device that keeps you safe. And remember, the idea was to address risk factor of isolation and increase protective factor of social support and inclusion. And we were really successful in that. And so we're encouraged to use best practices, but we're not really taught how to do that. And social ecology theory gives us this methodology about how to interconnect our work. So this theory says that active interventions in public health work are those that require voluntary and sustained efforts by both the individuals who benefit from it and preventionists. So examples of this are behavior change strategies and lifestyle changes. And the passive or environmental interventions in public health require no effort from individuals who benefit. So a common example of this is fluoride in the water. You don't have to think about that, or connected accessible sidewalks. And ultimately, when we practice these combined methods, we can increase sustainability in our field. We can increase our energy and impact as practitioners. And so let me show you how I practiced the behavioral, like what I did at the behavioral level to get the environmental level. So everything in the active category, I'm sorry that you can't see it. Everything that we did there related to what we achieved environmentally. So, and this is, again, just a fraction. So we actively conducted cross-agency trainings and built a coalition. A more inclusive, coordinated community response is now a passive benefit. And because those agencies just sort of operate with that awareness as a matter of course. And we actively mapped those 6 neighborhoods, businesses, and public spaces and advocated for sidewalks to get that environmental impact on the city infrastructure. And now the sidewalks are there for the entirety of Bloomington to use. We held inclusive events and relationship building activities in order to build trust and connectedness. And we spent like a year and a half just getting to know each other and building these relationships. And this led to organizations changing their bylaws to ensure that they addressed people with cognitive and developmental disabilities in their work. Like that was powerful. And then we developed that accessible evaluation and created we implemented those. So those are available for future use. We pushed for policy changes to get new policies enacted. So by connecting these methods, the active behavioral methods to the passive environmental ones, we ensured that our energy resulted in something endurable. Sorry, I meant durable. Our impact endures long after I left. I spent 2 years with this community, but the re-interior design took 4 total years. The sidewalk connectivity took 4 total years. So this is, it kept happening after the active driver of this, with my partners with disabilities, we pieced out and moved on. So by connecting your methods, by asking yourself, what passive change could this active effort lead to? You're doing a lot of active work. Like if you're not doing that, you're doing a lot of active work without this larger impact. And so combining these methods really helps workforce sustainability. And so, ooh, okay. I have more time than I thought I did. Okay, so this ultimately, this is a list, and I realize now that it's really tiny for you. To create lasting change, it's possible when our strategies are intentional and they're grounded in this connectedness. And I mean connectedness in terms of like that protective factor of social support and inclusion, but also in terms of connecting strategies or approaches across the levels of the SEM. And so by mapping your work and focusing on impact, not where the activity happens, but where the change happens, you're building those conditions for safety and inclusion and ultimately the liberation that happens in your communities. And so these are just a few of the impacts that happened as a result of this project. At the societal level, city investment in infrastructure, in creating those connected sidewalks for community members. At the community level, we had a promise from the transportation systems to pay attention to the bus routes that we discovered did not reach the most vulnerable people. So the poorer communities that were sort of on the outskirts of the bus routes were not able to get to work or to their doctor's offices or whatnot because this is a university town. Bloomington is where Indiana University, the flagship, is for IU colleges. And so the bus system serves the students, serves the needs of the students. It serves the needs of 50,000 people who come in temporarily and then leave. And the community is left here with bus services that do not serve us, the people who are here creating the infrastructure for the students to come in and benefit from. And so we discovered that bus shelters had doorways that couldn't allow power chairs through. Like it was based on the ADA measurement of 36 inches, which is based on a wheelchair, not a power chair. We found that shelter landing pads did not have like curb cuts. So people who were on excursions literally had to sit in mud. And one woman said, you know, when I get to work, I look a mess. I have no choice. I have to be in the mud. I can't get into the bus shelter, you know, when it's raining and whatnot. And it's not a good look. And so we actually had one of the areas changed to add the curb cuts, and they like opened the entire thing so there weren't like it's not as enclosed from the elements, but it does have 3 sides now, and people with power chairs and people with less mobility can actually get in much easier. We had the connected sidewalks. We had the emergence of a transportation coalition that the cross-sector partners formed with the leaders with disabilities, and that still exists today. And it's been 10 years or 8 years. So at the organizational level, we had that library interior remodel. They included accessible software, but they also made a new position called Director of Inclusion. And that person is still there. That role is still there. And one of the first things that person did was notice that there were ancient books about disability. Like we're talking 1940s. And I have to tell you, it is offensive to read books from that time. They use the R word here, like everywhere. And it's all about like lack of intelligence and whatnot. And so they got rid of those books or like put them away, and they got all new dated books. They like expanded that section and they keep it dated now. And I just think that's amazing. And then the organization that I told you about, it was called Women Writing for Change. They changed their bylaws as a result of the work that they did in that cross-sector collaboration. They recognized that they could do more for people with disabilities who are really left out of every opportunity. And they still do the project at they go to disability serving organizations with day programs, and they facilitate art and creative writing and creative expression as a means of communication. And one really cool individual level outcome of this work was the realization at the disability serving organization that people who communicate not using words were given different opportunities to communicate. So for the first time, someone was given a communication board, and that person had been thought to be like unable to communicate beyond like sounds, or like this person was isolated in her body because the people externally didn't understand. They assumed her capacity, that she didn't have any. And as a result of partnering with the Writing for Change women, this person communicated, drew pictures that indicated a lot more capacity. I hate what I just said. Just so you understand, I always believe that everybody has capacity for communication. It's just getting creative on how to facilitate that. And so
the typical, the typical stereotype, you know.
exactly.
Yeah.
Did you say they're capable, period?
Yeah, that is the
Yeah.
typical stereotype that if you're nonverbal, you can't communicate. And that's not true, you know?
Agreed. Yeah. And it was frustrating and it broke my heart because like this woman had been in this program for 20 years, sitting there with the
Yeah.
same staff who assumed that she didn't know what she wanted. And through this process, like drawing, like making pictures and art, her desires were expressed. And now they have communication tools. She can like a book of her preferences, and she can flip to them to indicate what she wants to do, what she wants to eat. And so it was just a beautiful outcome. Another, I see that we just have a few more minutes. One of the other really amazing things that happened is, so you can measure social support and inclusion on an individual level, like I said. So I did that too, because I wanted to ultimately see that the leaders with disabilities did have an impact on folks, like that they themselves experience social support and inclusion. And so one man, he was 65 years old. He in his initial assessment, he had no people listed for social support. He felt very isolated. And by the end of this 2 years, he had like his social network was huge. And one of the things that he did, that nobody really knew that he was interested in, is during these writing and art sessions, he wrote the cookbook that had 50 recipes of food he made with his mom throughout his life. And it actually just makes me want to cry, because again, there's this idea that he doesn't have support, he doesn't have friends, he doesn't have interests, and that is just ultimately not true. It never was. And so like he ended up with this beautiful cookbook, and the whole time he got to tell us about his family and his mom, who he missed so much. She passed. So he created this beautiful thing that he can have for the rest of his life and share with others. And so people did demonstrate self-worth, self-esteem, self-compassion, mobility, and one of the greatest gifts from this was spontaneity. If you are a person who has a guardian or who is at a day program, your spontaneity in life is very, very limiting. If you can ride the bus and go do public transport, but you don't know how, then you cannot engage in that spontaneous kind of interaction. And so this whole process allowed that to be possible. So re-envisioning the social ecological model means seeing it not just as levels to target, but as levels to connect, using power conscious strategies to create environments where nonviolence is the norm, and doing so in a way that sustains both your impact and ourselves as worker. And so because we're nearly finished, I just want to invite you to a series that I am doing in September. The collaborative that I founded, Nothing Without Us Collaborative, is partnering with the National Sexual Violence Resource Center to have a series. And this is in the slides that were emailed to you. And there is a link, and this is way too many words, and I know it's tiny, but the first session is called Disability Justice and the Public Health Approach to Violence Prevention. The second one is called Complicating Accessibility in the Anti-Violence Movement. And the third one is called Art as a Catalyst, Centering Disability Justice in Primary Prevention. And the link for you to register is there. And the last slide is just my contact information. And I would absolutely love for you to get in touch and talk anytime. I'm trying to stop the share. Okay, there we go. So I know it's noon. Does anybody have any questions or comments or concerns or anything like that? I'll look at the chat real quick since I closed this. Oh, that stinks that you couldn't read them. I'm sorry. I've never had that happen before where my face is forced to be bigger than the slides. Well, thank you for having me.
I wonder if you wrote this self advocacy organization of Indiana. They have a
Yes.
big.
Yeah, we actually partnered to create so that group that I told you about, Indiana Disability Justice, was a statewide task force, and SARTAC, the president of Self Advocates of Indiana had an internship with me that was funded by SARTAC, the Self Advocacy Resource, and yeah. So she wrote a guide, like a project replication guide with them. And with funding from the coalition, they have a Healthy Sexuality Speakers Bureau. That was my third year at ICADV. So absolutely, they're important. And I currently work at the Governor's Council for People with Disabilities, and we partner with Self Advocates of Indiana.
Did you know Betty Williams before
Betty Williams?
Yeah.
Yes. What an amazing human being.
She's a good friend of mine. A good friend.
That's awesome.
I knew it. I missed her.
I love that connection. Interstate connection. Yeah. Well, thank you so much for having me. Thanks for the invitation, Sam.
Yeah, thank you so much. So let me